Excuses are only good for those who use them. You can do anything in life that you want to do. Only you is stopping you. Hey y'all, hey, welcome back to the channel. It's me, Sunny Unique. I am 2 weeks post-op of my hysterectomy recovery, y'all. In today's video, I'm going to be giving you all a few must-have items. When I say they are must-haves, they are must-haves. And I'm kind of put them in, they're not going to be in order, but because baby, you really need everything I'm going to show you. The only one that may be optional is like the last two. With that being said, make sure your doctor or you taking somebody with you that can understand how to give you the pain medicine and the regimen and things of that nature, because you don't want to be in pain after surgery. With that being said, prior to surgery, depending on what your surgeon may do, what kind of cleansing wipes or solution they may give you, you want to get some of this. You want to get some of this. You're going to need this prior to surgery, and you're going to need this after surgery, okay? You want to use this to keep them marks, your incisions clean. I'm 2 weeks out, and I am still using this Dial antibacterial gold soap. Y'all know this is the holy grail. Get you some of this, all right? Now, listen. They is going to put a catheter in you during surgery. When they take that catheter out, it's going to feel like razor blades and scissors is going through your urethra, whatever it's called. You're going to want some of this. It's going to hurt to urinate. It's going to burn. You're going to share the tear too. It's going to really hurt. Now, that symptom only lasts for like a day or two. I had surgery on Tuesday. By Thursday afternoon, that burning sensation was gone. To be honest, I just burnt the whole time. When I did think to actually take this and read the directions, it pretty much said you have to drink it with food or right after food and with a full glass of water. But because I didn't really have an appetite, I was just on like crackers and something, and I didn't want this to give me an upset stomach. So with that being said, I never ended up using this. But baby, it's going to burn, burn, burn. And you really don't think about using this until you're actively on the toilet urinating, and then you're like, oh, I need to go take it, but it's too late. Not only that, you're going to want some cough drops. Your throat is going to be just a little scratchy, a little tender, because they got to put the tube down your throat. So a little cough drops, because baby, it's going to hurt to cough. We're trying to prevent you from coughing. It's going to hurt to cough. You understand? You're going to have to, if for any reason you don't got none of these on hand, you're going to want to get a pillow and just hold your stomach and cough. Let the germs fly. Just because you're going to have to hold your stomach or press a pillow into your stomach and cough. Now, the third thing, I can't even show you, but I don't know what number this is. You is going to need a heating pad. Borrow somebody heating pad, because I borrowed my sister's own. She gave me two. She had one you put around your neck and you put around your back. Then she had gave me this other one. You're going to need a heating pad, because that gas pain is going to have you crying. No pain medicine is going to touch that gas pain. Doesn't matter how high of a dose of pain medicine you take, it's not going to touch that gas pain. And I have transfer gas pains to where it be in my shoulder. It goes like in my chest, behind my heart. It will have you thinking that you're having an active heart attack. That gas pain is no joke. It gets stuck in my lower back like I'm having back labor. You gonna want a heating pad to help dissolve some of that gas. Not only that, baby, get you some gas at maximum strength. I'm just warning you. The first 2 days with that gas is going to be crucial. Mine's faded that Thursday evening. It kind of faded. But, yeah. With that being said, these two your best friends. Get you some Miralax and get you some stool softeners. The day you come home, you just want to do like 1 dose of Miralax and take 2 stool softeners a day. 1 in the morning and 1 in the evening. That anesthesia gonna have you so constipated. And with that being said, you do not want to strain when using the bathroom. You do not want to have to strain at all. You don't want to have to put no pressure on your bladder, on your cuff if you take that route. you want to kind of have a decent bowel movement. I had surgery on Tuesday. I had my first bowel movement that Friday. It may take you a day or two to get it flowing, but keep in mind that you kind of taking this help with the food you're starting to eat after surgery. This help move what you already ate prior to surgery. With that being said, now this item is very optional. When I say it's very optional, with being in a hysterectomy groups on Facebook, for some reason, a lot of people get a lot of UTIs and a lot of, I guess, dryness or infections down there, BV. This one thing I have noticed after surgery. I guess since the uterus is gone, by the time I feel like I have to go to the restroom, I'm on a full bladder. You know how you've been waiting all day to pee, and then when you pee, it's like you was completely full. Randomly go to the bathroom. If you got the energy to get up and go to the restroom, and that's going to help prevent having a UTI. Y'all know the saying, if you hold your pee too long, you're going to get a UTI. The sensation, I guess, because the bladder have more room to expand or it's not bumping into like your uterus to know that, hey, it's full. I kind of, when my body tell me I need to go, it be a full bladder. You kind of want to take these to help with that. Also, I take it for like my stomach and other issues I have, but I've been taking these every day since surgery. Also, this item right here is optional. When it comes down to the surgery, this is not a like one size fit all surgery. Some people spot after surgery. Some people still bleed after surgery. Light spotting and bleeding is normal up to 6 weeks after surgery. With that being said, you're going to need some kind of sanitary napkin, some kind of panty liner to help you out with that. Me, myself, and I have not spotted or anything since the day after surgery. After surgery, I had like a little spotting, but since then, I have been completely no blood, no spotting, no nothing. Not to jinx myself, but it's been good so far. With that being said, I will say those are my few must-haves after surgery. Also, if you have any questions, make sure you leave me a question down below, because I'm going to do a Q&A with my hysterectomy in a little bit, and I'm also doing a 2-week update. With that being said, y'all, one thing I am going to say before I end off this video, this surgery is, like I just said, it's not a one fit all or one fit most. Everybody have different experiences. Everybody's body is different. Everybody react to different things differently. Your best thing for you to do is, when you have your pre-op surgery, is to drill your doctor with what's best for your body. Because even though I say these are my must-have, you may not be able to take a stool softener. You may not be able to take Miralax. It's very best to speak with your doctor. They will give you advice of what they think you should do and what you shouldn't do after surgery, because everybody's prior situation is different. It's kind of like and just being in different Facebook groups, when I sit here and tell you every doctor recovery instructions is completely different. Some people got to wait 12 weeks. Some people got to wait 8. Some people got to wait 6. Some people get belly binders. Some don't. Some take this medicine. Some don't. Some say they couldn't drive for 4 weeks. Some say they could drive as soon as they feel like it. When I just say every doctor is different, you have to listen to your body and your doctor. Yes, we get tips and advice from others, but you and your doctor know what's best for you and your body. With that being said, this is the end of this video, and I will see y'all in the next one. Deuces.